Hi, my name is Polina Rod. I'm a sophomore nutrition major here at UMass, and today I will be talking about iron-rich foods and anemia. The research question that I've been focusing on that asks, does an iron-rich diet and supplementation treat iron deficiency anemia? And this presentation will answer all of those questions. And my goal for this presentation is to encourage people to follow an iron-rich diet to help lower the risks of developing iron deficiency anemia. So what is iron exactly? Iron is a mineral that helps maintain many of the body's functions, and iron is really necessary for growth and development. The body uses iron to make hemoglobin, a protein in the blood that carries oxygen from the lungs to the body. When the body doesn't contain enough iron, it is therefore lacking healthy red blood cells. And when the body is lacking healthy red blood cells, this results in a health condition known as anemia. Iron is an essential nutrient, meaning the body does not create it naturally, so it needs to be absorbed from consuming foods. What are the benefits of iron? Well, there are many benefits. These include proper red cell production, supporting focus, reducing fatigue, maintaining normal oxygen transportation in the body, maintaining stamina, and encouraging healthy pregnancy in pregnant women. So there are two forms of iron. There's non-heme iron, which is iron found in plant-based foods such as spinach, lentils, tofu, whole grains, nuts, seeds, legumes. And then there's heme iron, and this form of iron is found in animal foods such as red meats, fish, and poultry. This form of iron is also most readily absorbed by the body, and eating meat increases your iron levels more than non-heme iron foods do. Combining these two forms of iron-rich foods can help combat developing anemia. So, combining a mixture of these two forms of iron is really beneficial to reduce the chances of developing anemia. So, what is iron deficiency anemia? It's when the body does not have enough healthy red blood cells or hemoglobin, and therefore prevents oxygen from flowing to the body's tissues. Anemia is also the most common form of micronutrient malnutrition globally, according to the World Health Organization, and it affects many people. So, what exactly are the symptoms of anemia? The symptoms include excessive tiredness, fatigue, brittle nails, pale skin, headaches, all of which affect an individual's daily life and quality of life. So, who is affected by iron deficiency anemia? Well, according to Duncan, about 20% of women, 50% of pregnant women, and 3% of men do not have enough iron in their bodies. So, from these statistics, we can conclude that the majority of individuals affected by iron deficiency anemia tend to be pregnant women and women in general in comparison to men. And men can develop iron deficiency anemia, but it is way less common for them to in comparison to women. So now let's talk about what an iron-rich diet is and how it prevents iron deficiency anemia. So, an iron-rich diet can improve the body's overall energy levels, growth and development, and synthesis of hormones. It preserves vital functions in the body, such as energy and focus, gastrointestinal processes, the immune system, and it even regulates body temperature. In addition to this, it is important to also keep in mind how iron-rich foods are absorbed in the body. And the best way for iron to be absorbed in the body is to consume foods high in vitamin C with a food high in iron, um, since this can absorb iron better than having a food high in calcium with iron. So, avoiding foods such as coffee, tea, and calcium rich foods can help absorb iron in the body better. And you may be wondering, what exactly are iron rich foods? These can include legumes, nuts and seeds, dark leafy greens, tofu, meat, and eggs. And incorporating these foods into the diet can reduce the chances of developing anemia. Moving on to iron supplementation. So, sometimes following an iron-rich diet doesn't always work for every individual with anemia. So, typically, individuals will turn to taking iron supplements to increase their iron intake. Iron supplements come in various forms, and they usually contain ferrous and ferric iron salts. Taking iron supplements should always be consulted with a healthcare provider to follow the correct iron RDA to avoid exceeding the recommended amount. Overall, increasing iron intake and when taking these supplements accordingly can reduce symptoms of anemia. Study 1. So this was a study done comparing ferrous sulfate and iron sucrose in iron deficiency anemia in pregnancy. So this was a randomized control trial, and the goal was to determine the effectiveness of these two different supplementations to treat iron deficiency anemia in pregnant women. The method of this study was to take 268 pregnant women between ages 18 to 45 years of age with moderate iron deficiency anemia and randomly divide the patients into two groups. The first group received intravenous iron sucrose, and the second group received oral ferrous sulfate tablets. In conclusion, the study found that the intravenous iron sucrose was more effective to treat iron deficiency anemia in pregnant women in comparison to the oral ferrous sulfate tablets were. Study 2. So this was a study done on rats, and it was an animal experimental study design. The goal of the study was to investigate reduction of hemoglobin levels in a rat with iron deficiency anemia by modifying its diet to keeping it at a regular diet and then giving it a low iron diet. The methods of this study included taking 24 female rats that were randomly divided into four groups. The first group was the control group, and they were given the purified diet of American Institute of Nutrition mature formula standard food for 15 days, and the rest were treatment groups administered with a low iron diet of standard food for 5 days, 10 days, and 15 days. In conclusion, the treatment group's hemoglobin levels were significantly lower than the control group's hemoglobin levels because the treatment group was receiving a low iron diet, meanwhile, the control group was receiving a regular diet. Treatment group 3 had the lowest hemoglobin levels in comparison to treatment groups 1 and 2. Study 3. This was a study that was done between food insecurity and iron deficiency anemia in United States adolescents. The type of study that was done was an observational cross-sectional study, and the goal of the study was to investigate the current relation of iron status and food insecurity status among children ages 3 to 19 years old. The methods of the study included taking participants from the National Health Examination Survey that were classified for food security by using the United States Children's Food Security Scale and the United States Household Food Security Scale. And as a result, the study found that iron deficiency anemia among children ages 12 to 15 years old were 2.95 times more likely to experience food insecurity in their households than children with food security in their households. This means that children who were experiencing food insecurity, also known as a lack of available food access, were not receiving the enough iron-rich foods in their diet. Therefore, they were developing iron deficiency anemia, and the children that were food secure and did have access and availability to the majority of foods were receiving iron-rich foods, therefore were not developing iron deficiency anemia. So there are a few key takeaways from this presentation. One of them being is that iron deficiency is typically always treatable and not deathly, but it is really important to maintain iron levels properly in order to stay healthy and maintain a good quality of life. And incorporating iron-rich foods in the diet can help prevent developing anemia. In addition, iron supplementation can also prevent and treat anemia when needed. The relationship between iron-rich foods and anemia is so connected, and exploring this relationship is very crucial for everyone to understand because then we can all maintain a healthy lifestyle and have a great quality of life. A few key takeaways from the research studies that we just went over is that an iron-rich diet is necessary in order for children to avoid iron deficiency anemia. Ferrous sulfate supplement and the iron sucrose intravenous supplement was effective in treating iron deficiency anemia in pregnant women, but the iron sucrose was more effective than the ferrous sulfate supplement based on the study. And a low iron diet over time results in a significant decrease of hemoglobin levels, and a decrease in hemoglobin levels results in less healthy red blood cells, and then that results in developing iron deficiency anemia. Thank you.